We're chatting today about pelvic floor health with Dr. Raymond Bologna, a urologist from Akron, Ohio. Dr. Bologna has agreed to take questions from ShareWick members who have sent their questions in over the internet. First up is Georgia from Centerville, Iowa.
Dr. Bologna, what can you do about urinary leakage during sex?
Let's talk about a patient that I saw last week. She was 48 years old, and she knows she started having some leaking during intercourse, and this certainly was causing a problem. And her symptoms were primarily that urgency. She felt during intercourse all of a sudden things had to stop, she had to run to the bathroom. So we were able to put her on medication. It calmed down her urgency and frequency and took away that sudden need to urinate, and then all of a sudden when she came back to the office, she was no longer having problems. Another way we can go is pelvic floor therapy. And whether it's the urgency or the stress incontinence, we can use pelvic floor therapy to strengthen the pelvic floor. That can reduce that urgency. And on the benefit side, if we strengthen the pelvic floor, she may experience not only a reduction in that urgency, but some other improvement in her sex life, where she's going to have a stronger pelvic floor and may even have better orgasms as a result of her strengthening her pelvic floor.
Dr. Bologna, when we're talking about treatment for stress incontinence, a lot of times what is mentioned is the pessary device. I was wondering if you could actually tell us what it is and what it does.
A pessary is a little ring. They come in all different shapes and sizes. And the idea behind it is it's a non-surgical treatment. A lot of women may use them between pregnancies. Say you have a child, you're starting to have some leakage, you're not ready to have surgery yet, you can use a little ring or pessary. So this is an example of one. This is a simple ring, and it sits in vaginally. So it's soft on the sides, and it just slides in vaginally and gives somebody that extra support. Now the little knob pushes up on the tube you urinate through, so it's going to fit kind of behind your pubic bone. Push up on the tube you urinate through, so when you cough, sneeze, lift, anything that causes your bladder to drop down or your pelvis to push down, this is then going to push up on the tube you urinate through and prevent you from leaking. You can leave them in all day long, you can leave them in for weeks at a time. We do recommend that they periodically come out, be cleaned, and then placed back in. Anything that soap and water that doesn't bother you won't bother this, and they last for years. So it's a nice option for a woman who's not ready to have surgery yet, maybe in between children, and then at a later date can go on to a surgical correction.
Hi, Dr. Bologna. I've had a baby. What can I do after to help prevent incontinence?
Well, certainly getting a good, strong pelvic floor prior to pregnancy, doing your Kegels during pregnancy, and doing them afterwards is going to help prevent this down the road. It's not going to correct everything for everybody, but certainly it's a great preventive measure that's simple and easy to do.
Dr. Bologna, I understand that they're actually using Botox as a treatment for overactive bladder. Is this true, and what exactly are they doing with it?
There is truth that urologists are trying to break into the plastic surgery world by dabbling in Botox, and the idea behind it is if you have an overactive bladder, when you gotta go quick, or you're leaking on the way to the bathroom, we can inject into the bladder in multiple locations with a small amount of Botox, and that'll relax your bladder just like it'll relax your forehead, and take those muscles and make them calmer so you're not getting that bad urgency yet. It's slowly getting approval throughout the states. A couple things that we're seeing is that patients may require more than one injection, usually about 8-9 months it's going to last, and then they're going to require another injection. The other thing that we see sometimes is afterwards it can relax the bladder a little bit too much and you have a hard time urinating. But certainly for that patient with the overactive bladder, the I gotta go now, or going frequently, or leaking on the way to the bathroom, and the medications aren't helping, it looks like Botox may be another option down the road.
Dr. Bologna, thank you so much for joining us here on ShareWick. This has been great information. If you'd like more information about pelvic floor health, please go to our website at www.sharewick.com.